Before we get started, I'll read through a checklist to ensure that the meeting that we are holding is in compliance with the right to know law. As chair of the committee to study the safety of residents and employees in long-term care facilities, I find that due to the state of emergency declared by the governor as a result of the COVID-19 pandemic and in accordance with the governor's emergency order number 12, pursuant to Executive Order 2020-04 and its extensions, this public body is authorized to meet electronically. Please note that there is no physical location to observe and listen contemporaneously to this meeting, which was authorized pursuant to the governor's emergency order. In accordance with the emergency order, I am confirming that we are providing public access to the meeting by telephone, with additional access possible by video and other electronic means. We are utilizing Zoom for this electronic meeting. All members of the committee and selected legislative staff have the ability to communicate contemporaneously in this meeting through this platform, and the public has access to contemporaneously watch and/or listen to the meeting on Zoom or YouTube, and via phone by following the directions and links provided on the general court website. We have provided public notice of the necessary information for accessing the meeting in the Senate calendar. We are providing a mechanism for the public to alert the public body during the meeting if there are problems with access. If anyone has a problem, please email remote senate, that's one word, remote senate at leg.nh.us or call 603-271-3043. In the event the public is unable to access the meeting, it will be adjourned and rescheduled. Please note that all votes taken during this meeting shall be done by roll call vote. Finally, let's start the meeting by taking roll call attendance. When each member states their presence, please also state where they are and if anyone else is in the room with you during this meeting, which is required under the right to know law. I will call the roll. Senator Morgan, myself, I am here in Brentwood, New Hampshire, and my 5-year-old and 2-year-old are watching Mickey Mouse Clubhouse, which you can probably hear. Senator Ward.
I'm here in my home and started alone in the room.
Representative Stringham.
Yes, I am in Fulshire, Texas, at my son's home, waiting the birth of my first grandchild. I am in a room by myself, although other members of the House may come nearby.
An early congratulations, Representative. Representative Birch.
And good morning to all. I am alone in Westmoreland, New Hampshire. There's no one else in the room with me, and an early mazel tov to Jerry.
Look, it looks as though Representative McMahon is not with us. All right, we're ready to get going. Has everyone received a copy of the minutes from September 17th?
Yes.
Mm-hmm.
I would look for a motion to approve those minutes.
So moved.
Seconded.
All right, we have a motion on the floor. Representative Ward. I'm sorry, Senator Ward. My apologies.
What about it? I said I approve. I'd make a motion to approve. Are you talking about the roll call? Yes, I approve the minutes.
Representative Stringham.
Yes.
Representative Birch.
Yes.
And Senator Morgan is yes. Thank you all for that. Next meeting dates, I have Thursday, October 1st at 10 a.m. And how does the following Thursday, that would be the 8th, look for folks on the committee? Are there any conflicts?
Wide open for me.
Are you talking about 1 o'clock or what? On the 8th?
I was hoping for more like 10 a.m.
Okay, that's fine with me.
My only issue is on October 1st, I have another Zoom at 9 o'clock, which may or may not be quite finished by 10. Is there, if that can't be shifted slightly later, so be it. I'll just leave the other one early, but if there's any way of making it a little bit after 10 o'clock, that would be nice.
I think that this might have already been scheduled, unfortunately, Representative. So
Okay.
just because of the lack of a lot of availability for the Zoom slots, I think we'll stick with the 10 a.m. and if
And
you
on the 8th is open and I can create the Zoom information for it.
okay, Representative, would you like us to move to 10:30 for the 8th, or is
No, 8th is fine.
so let's do 10 a.m. Alan on the 8th, if we could.
Got it.
Great. And that's good for the future meeting dates. And now I think we're ready to begin with the testimony from Brendan Williams, the President and CEO of New Hampshire Healthcare Association. Is he with us? He is. Mr. Williams, thank you very much for joining us, and the floor is yours.
Good morning. I'm trying to figure out how I actually can be seen on this forum. My apologies. Normally, if I access a Zoom meeting, there's an option to opt in through video.
Mr. Williams,
Yeah.
I can take you off, allow me to talk and try to promote you as a panelist, and then you should be able to do video if you don't mind just holding 1 second.
Okay, that sounds good.
I think you're the first one to actually want to be seen after being switched over to a panelist. So thanks for being the first.
Yeah, if I had the option of trading with you, I think I would have done that, Brendan.
We see you now. We can't hear you, but we see you.
All right. Okay. I think we got it going here. So for the record, I am Brendan Williams. I am the President and CEO of the New Hampshire Healthcare Association. I am in Boston, Massachusetts, and I am alone in the room. However, a friend of mine might enter the room. So thank you for giving me this opportunity to testify, and thank you for the important work of this body in terms of examining what has truly been a crisis in nursing home care over the last several months, and really all of long-term care. It's just been a shattering experience for all of us. I'm going to try something here, which is to share a screen. This could potentially be a disaster, but I think I can figure it out. So let's see here. How would we do this? Page layout. Okay. This works so well practicing, but might not. Okay, hang on 1 second here. Now, orientation. Nope, that's not it.
If you go to view,
View. Oh, okay, thank you, Senator. And I think if I do, there we go. Well, that's not really what I wanted to do either, so I'm sorry. These are interesting times for all of us. Okay, well, this is going to have to do. So I wanted to share with you first some statistics that pertain to nursing home care in New Hampshire in particular, just to kind of give you a way of assessing where we're at right now. Prior to the pandemic, there's what's called CASPER data, which is basically a means that the federal government uses of capturing survey data. All nursing homes are surveyed at the state level in accordance with what's called the State Operations Manual. It's 749 pages of guidance and includes what are commonly called F tags or federal tags. And those are the citations that facilities can get for things like infection control, and infection control might include laundry or various other unconformities with what the federal expectations are. So Prior to the pandemic, New Hampshire was #1 in the country when it came to substantial compliance with those federal health survey standards. And I want to quickly note too, I think one of the concerns that we've seen nationally has been that, and I think it's been true in a lot of states, that surveys sort of ceased during the pandemic for various reasons. In some states, it was because of a lack of personal protective equipment for the surveyors. In other states, it was just a sort of a rigid exclusion of any non-essential personnel, with surveyors somehow being regarded as non-essential. And that was never the case here in New Hampshire. We continued throughout the early part of the pandemic to have infection control surveys, and we are back to having annual surveys now. Obviously, they were a little bit backed up on that, but those surveys are ongoing as we speak. I think a survey team is in at least one facility right now. And unlike other states where the concern on the part of the sector has been that the surveyors themselves are not getting tested for COVID and are just going from facility to facility, here they are in fact getting tested for COVID, just like nursing home staff are. And they're coming in gowned, and they're being very meticulous about not going from an area in which there might be infection into areas that might be free of infection. So I think that's commendable. We had the third fewest deficiencies in the country per facility prior to the pandemic. Since the pandemic began, there was $175 billion that was set aside by Congress for healthcare provider relief. Nursing homes have received 4.2% of those funds, even though the percentage of the nation's COVID-19 deaths in nursing homes has been 40%. The most recent federal assistance distribution, $2.5 billion nationally, cannot be used for staff retention, which really is our existential issue right now. One of your charges is staff safety and certainly resident safety. And I'd say that the federal response has ill-served those interests, and we'll get into that analysis. Prior to the pandemic, probably lost given that the pandemic was already underway, there was a report issued to Congress, which is issued annually by the Medicare Payment Advisory Commission, that showed that on March 12th of this year, that showed that the average nursing home margin was in the negative for the first time since 2000. And those were the 2018 margins for nursing homes. So the sector was already pretty precarious even prior to the effects of the pandemic. Just to give you a picture of our association, about a quarter of our member nursing homes are nonprofit. That counts the Cedar Crest Center for Children with Disabilities, which is a kind of a pediatric nursing home. 6 of our member nursing homes are family-owned, just individual operations. And those particular operations are especially, I'd say, precarious because they don't have the resources of large organizations to draw upon. The average age of a nursing home admission in New Hampshire is older than is true nationally. The average age of a long-stay nursing home resident in New Hampshire is older than is true nationally. We have one of the nation's oldest nursing home populations. There used to be a useful resource that the federal government put out. For whatever reason, it discontinued it in 2015. So the most recent data we have is 2014. But by that measure, we had probably the nation's second oldest nursing home population, considering the fact that we had the second highest proportion of women residents in our nursing homes. I think that that was second to Rhode Island, and I think we have surpassed that since, but we don't know because the federal government isn't keeping that data anymore, unfortunately. So, but we know that age is correlated to mortality when it comes to this virus, and sadly, we've seen that occur in our facilities. Just to give you an example of community spread and how it infiltrates nursing homes, we're all familiar now with the super spreader Maine wedding outbreak that occurred that somehow has killed, as of last count, 6 nursing home residents in a facility that was 100 miles away from the wedding venue. None of those nursing home residents were in attendance at that wedding. So it's very hard to keep out of facilities, and we'll get into that too. We have been advocates in the national media over the shortcomings of the federal response to providing both testing and personal protective equipment to nursing homes. It's really been absolutely shameful. There was an effort that was pushed by Senator Hassan and supported also by Senator Shaheen to get $20 billion in funding discreetly for nursing homes. And at that time, Senator Hassan said that there was no national strategy whatsoever that you could discern relative to the crisis in nursing homes and the federal response to it. And sadly, so many weeks later, that remains the case. So we did receive 2 weeks worth of personal protective equipment from the Federal Emergency Management Agency. That equipment was defective, and why it was only 2 weeks, I can only hazard a guess, because the pandemic did not end within 2 weeks and won't end within 2 months, or maybe many months at this point. There was a National Nursing Home Commission that you may have seen that was set up by the federal government, included resident advocates, sector representatives, and leading academics. It recommended that the federal government facilitate the provision of 3 months worth of personal protective equipment to nursing homes. It also recommended that Medicaid rates be increased by 12% to account for the costs of staff in the face of this crisis. And I don't see either of those two things ever happening. So this is just kind of an example of some of the media that we've gotten in terms of the sort of useless federal protective equipment that we've gotten. We had been early proponents of testing for all staff. And I'm pleased to say that, New Hampshire, if you look at, there was some data that Pew had put together early on, and we were one of only 6 states, I believe, at that time that were regularly testing nursing home staff, and began also testing nursing home residents. Other states weren't doing it. Other states are now going to have to do it under a CMS directive that was just issued within the last couple weeks. I would point out that that directive was issued after 77,000 nursing home residents and staff had already died. So how that's going to be accomplished in some states, I'm not sure. Here we have sentinel surveillance testing every 10 days of all nursing home staff. And then based on a risk algorithm, 10% of all residents are also tested. And those risks would be comorbidities. In some cases, residents with dementia are not very compliant with social distancing and some of the other safeguards that are necessary in order to keep them free from the virus. And so they too get tested. Yesterday, no, it wasn't yesterday. Was it yesterday? All these days are blurring together. Commissioner Shibaded announced that we're going to be transitioning to a testing model in which providers themselves are responsible for the testing. However, that's not carte blanche. What will happen under this regime would be that facilities would test all of their staff 1 week out of the month. And then the other 3 weeks, they would test 10% of the staff. And they're going to move away from the resident testing because, frankly, the way in which the virus gets into the facility is through asymptomatic staff. And so if you catch it in the staff, you're going to catch it before it gets to the residents. However, they are going to continue to do outbreak testing. And so if a facility has an outbreak, the state will come in and test everyone. So we're a little worried, I think, about, well, of course, we're worried about a lot of things right now, but a little bit worried about this transition. The state will continue to contribute funding towards this new testing model, $100 per test, which is probably less than the cost of a PCR test, which is the expectation. But some providers will be able to negotiate. They have the scale to negotiate prices. Some providers are going to be in a little bit more of a difficult situation. The federal government has supplied what are called antigen testing machines to nursing homes, which are rapid result tests. One is made by Cadell. It's the Sophia test. Its sensitivity rate is very high. It's very accurate. It's only to be used for symptomatic residents, as is true of any antigen testing machine. However, the federal government has also preempted all state public health departments and directed that these machines can be used for asymptomatic people as well. And so in theory, they could be used for sentinel surveillance, but I can tell you that our Department of Public Health would recommend against that. The other machine that is most widely distributed to nursing homes has been the BD Veritor machine made by Becton Dickinson. That machine is very unreliable. It generates a false negative rate of 16%, which is so high that were you to test someone and they were to test negative for the virus, you actually have to validate the result with a PCR test, which then sort of begs the question of what the value is of the BD Veritor machine if it's a rapid result test that requires validation through a test that takes days to get returns on. So the more promising development is that the federal government has started to ship what are called Abbott Binax tests to nursing homes. And those are basically cards that apparently have a very high sensitivity rate and are kind of like you swab and then scratch and you get your results. And I think the cost of those is maybe $5 each. So between that and some other developments like the Yale saliva test, we're hoping that we can be armored with a lot of different testing mechanisms, including the state required PCR testing that will hopefully do a better job of keeping our facilities free from the virus. We've also had a lot of state advocacy in the state media. And, we focused on things, whether it be workforce, for some time there were $300 weekly stipends being made available to nursing home staff and other long-term care staff serving Medicaid clients who are on the front lines. It was $150 for part-time staff. That program has been discontinued, unfortunately. It was really a lifeline for a period of time. It was somehow less progressive than a program in the state of Alabama, where they not only had the stipends, but they also increased the rates by $20 per day. But still, it was very helpful while it existed. We've also been very strong proponents of, even before the sort of Mask Up New Hampshire effort, which we joined, of people wearing masks, because our staff are forced into situations in which they go to the grocery store or other places, and they can come into contact with people who are being careless about social distancing or mask wearing. And so we have supported all mask ordinances and would support the one that's being proposed for Manchester. We've also just talked about the human toll of the virus upon we're not talking just the facility finances, which we've also talked about, but really upon residents, their feelings of isolation. There was a good Washington Post article within the last week centering around the story of a man and his wife who's in a nursing home, but just talking about how the incidence of deaths from dementia are much higher than what you would normally expect. And I think that that's really in part because of the feelings of isolation that residents have experienced. And so we've been proponents and working with the state of greater visitation. And initially we had the outdoor visitation, which was no contact, you're 6 feet apart, and everybody's wearing masks. And that doesn't work for all residents because some of the residents have hearing impairment. And so if they're wearing a mask and their loved one's wearing a mask, they really rely in part on reading lips, and they can't understand what it is that their loved one is saying. So that's no good. And plus there's no physical contact allowed. And we all know how important that is for the psychosocial well-being of residents. So it was an outdoor visitation that obviously couldn't continue indefinitely in New Hampshire. We're starting to approach the winter. And frankly, it wasn't that pleasant this summer either, given how hot it was. And it also didn't work for a lot of the dementia residents because they don't appreciate, and most residents do have some measure of dementia, because they don't appreciate some of the social distancing requirements. They don't want to wear masks. And so it was really a useless experience for them. So now we're moving it indoors where residents have designated loved ones who they can physically interact with and do so as safely as we can accommodate it in their rooms, with their roommates absent or in designated areas. And I think that that's going to be a lot better for residents. And I think that if we can get some more testing that's reliable and start to restore some of the community activities that occurred, you may be aware that we haven't had communal dining, for example. We weren't able to have group activities. I think all of those things would be very positive developments for the residents. One of the things that has been striking about New Hampshire, and I've been asked by members of the media, and I don't have an explanation for it. I have theories about it, but I have no real explanation for it, is why such a high proportion of our deaths in our state have occurred in nursing homes. The number of deaths in the general public has been relatively low, making those deaths in nursing homes proportionately very high. I think in part it's because we have such an elderly nursing home population. Prior to all of this, I'd gone around and interviewed centenarians that were in our nursing homes and assisted living facilities. We have people who are in their 90s in assisted living facilities. And so obviously age makes you especially susceptible to the virus. But you can also look at us compared to other states. And if you look at, for example, the state of New Jersey, 80% of the deaths in that state were not in nursing homes, 44%. But also 17% of all nursing home residents were killed by the virus. So other states have obviously had, in that sense, a much harder time of it. And because so many deaths occurred in the community, that reduced the proportion of deaths that occurred in nursing homes. And finally, before I take your questions, just with respect to the academics, I think that there have been a number of studies, and I'm incorporating some of them in a law review article that I'm going to have published this fall, that have found that, no matter what kind of facility you are, if there is community transmission, as was the case up in Maine, the virus will find its way into the facility. And maybe that won't be true, once we get all these testing tools at our disposal, but it certainly has been true to date. That the virus just inexorably gets into facilities if there's any kind of community spread. And then I think, the heroism of the workers in nursing homes gets overlooked. And I'm not just talking about the licensed nursing assistants. A population has long been marginalized, 92% women, majority are women of color. They've long been seeing their wages depressed by Medicaid reimbursement, not just in our state, but throughout the United States, but also the housekeeping and dietary and maintenance staff. And as we get the economy going again, you see a lot of employers that are offering $15, $17 an hour for service jobs. And even our county run nursing homes, which are obviously not operating at a profit, cannot compete with those types of wages, even for licensed nursing assistants in some cases, quite apart from the other staff that are necessary to do the work in nursing homes. Our censuses are down. Anytime there's anything that looks like an outbreak, admissions stop. And that's, created some challenges. And another reason why our censuses are down is because elective procedures were on hold at hospitals. And after those procedures, people are commonly discharged into nursing homes. And so we have facilities that, normally as a state, we were running pretty full compared to other states because we have a bed moratorium. And so we're not building new nursing homes. And so typically we'd have a census that was in the 80% range. And in some cases now we have facilities that are operating half full. So it's really, really challenging for them. So with that, I'll take any questions and thank you for your time.
Mr. Williams, thank you very much. Really appreciate the depth of your insight and experience that you share with us all. Committee members, are there any questions? Representative Birch.
Thank you. And thank you, Mr. Williams. You're just the person I want to have a couple of questions with. So first, two real quick ones to get them out of the way, and then I have a couple more detailed ones. The description you gave of testing staff but not residents in the general case, is that something you support?
I would err personally on the side of caution. I've said this from the beginning to the national media. I mean, one of the things that, was great about our testing regimen that I think really was better than most other, if not all other states, was that we were testing, the staff every 10 days. But I'd always say, what about the other 9 days? That was always the challenge, even with that testing regimen. I could get tested this morning, for example, and this evening I go to Walmart and I get exposed to the virus. And so I show up to work tomorrow and I'm positive. Well, the fact that I was negative won't be known for a couple of days because it was a PCR test. And then the fact that I'm positive won't be discovered until the next time I'm tested. So, I mean, there's always that kind of a risk that exists. In terms of testing the residents, because I think the greatest risk is the asymptomatic staff. That is obviously where the focus should be. I guess a concern that I have in not testing the residents is that we are allowing visitation now. And so it's not just asymptomatic staff who could possibly be tracking the virus into the facilities. It could be family members. And, I'm glad that family members are coming back. I think one of the things that people don't appreciate is that family members were, and I think a number of you probably do understand this because you visited your nursing homes in your districts. But before the pandemic, nursing homes were full of family members, and they were there to visit their loved ones. They were there to volunteer, assist with the care. And so we're happy to have them back in this sort of limited capacity, but it does carry with it the risk of the virus entering the facilities. Maybe that can be prevented through these antigen testing devices. All that stuff's going to get better. But yeah, I have some concerns about the residents not getting tested.
If I could just follow up, and I'm going to skip one of my shorter questions and really get to a core question for me. And that is, we have staff coming in and they get tested. You've described what could be the future, but we all know what the current is. And once that testing is done, which is fairly brief, it's a temperature and whatever, then there's interaction between the residents and the staff. And I'm concerned about whether that can also be, what's the difference between that and a family member or a loved one coming in and going through the same process, but can't have an interaction with their loved one inside? Because it seems to me, especially for the dementia patients, that the ones who can't communicate verbally, the ones who have all those kind of cognitive problems, that it's the touch, it's the hug that maintains a level of functioning that we want to have continue. So if we can do that for the staff, why can't we do that for loved one? Why aren't we doing that for loved ones coming in? And related to that, and I just picked up on it when you spoke, you talked about the internal visits that are starting, that your understanding, and I'd like you to clarify, is that when a loved one or two, depending on the facility, meets with with the resident in a room, that a certain level of physical interaction, touching, hugging, is allowed under the protocol. Is that true?
That is true, as of my understanding. We facilitate a weekly call and have done so since the early part of this pandemic with the state epidemiologists. And so we have, for example, Dr. Beth Daly from Public Health. We have Dr. Benjamin Chan, Dr. Elizabeth Talbot, and they're all, experts in infectious disease. And my take on all of this has been, I respect the science. I defer to the science. I believe in Dr. Fauci. I don't believe in, a political response to any of this. So I think that, so long as the science is there and the public health experts say that this type of visitation can occur, we are obliged to salute the flag and then allow that to happen and facilitate it as best we can. And so that's basically where we've been at. I appreciate your point, Representative. That's a point that a number of resident advocates have made. I'd say the only distinction is just that it's kind of falls upon the definition of essential workers, and we've all had that sort of discussion, I think, ever since the pandemic started. What is an essential worker? And clearly those persons who are working in nursing homes are essential workers, so they have to be there. Others don't have to be there. And so we've had sometimes some arguments, I guess, with public health. For example, we wanted to allow beauticians and barbers to come at the facilities. And I think the epidemiologists were a little nonplussed by that because they didn't understand how these people were essential. Well, they are pretty essential for a lot of the residents, just in having some feeling of normalcy. You wouldn't want to go months with a LNA cutting your hair, however well that LNA might be doing in terms of cutting your hair. And so we're trying to get that sense of normalcy back. So similarly, right now, there's a lot of facilities that would like to get pets back into the facilities. And yet there is some risk that animals can carry the virus. I don't think there's any evidence that any animal has ever transmitted the virus to a person. I think it's gone the other direction, but we're having, some challenges just getting animals other than therapy animals into the facilities, and those animals were a great comfort to the residents. So it's all, I think, a real juggle with the science, in terms of how we're able to accommodate these things. But I think your points are well taken. I understand them.
Representative Stringer.
Yeah, obviously I'm concerned about the high mortality rate in the state of New Hampshire, which has been largely concentrated in long-term care facilities. But I'd like to switch to something else a little bit. In today's Manchester Union Leader, you talk about the extreme financial distress that is endangering some long-term care facilities. First, in the short term, is the concern that the financial distress as a leading to any immediate risk to the residents? And second, could you just kind of comment? I think you talked about low occupancy, so I assume these facilities have a lot of fixed costs. That with the lower occupancy is why they're dipping further and further into their reserves just to stay afloat. But if you could comment on those two things, and then whether any of that leads to any recommendations for us, I'd appreciate it.
Yeah, a lot of my member facilities, even prior to the state and federal aid being afforded, took out PPP loans in order to be able to do wage augmentation for their staff. Now, not all types of facilities were able to take out those loans, but a lot of the private proprietary facilities did take them out. And so that was a bit of a bridge. I've always had a philosophy when it comes to quality of care, and this goes back, I've been involved in long-term care, took a break from it, but, for about 20 years. And that philosophy is that there are a lot of excuses that could be made for substandard care. The fact that government doesn't support care adequately through Medicaid, is certainly one of them. But, if you're not able to provide quality care for whatever reason, perhaps through no fault of your own, then you need to consider closing your facility because it's not acceptable ever to provide substandard care. I think what we've seen in New Hampshire is that facilities are just simply limiting the number of residents that they can admit based on their staffing shortfalls. So, which I think is laudable because you look at other states, and they're just jam packing people in. And unfortunately, in a lot of states, they actually had some financial incentive to take COVID patients, which we certainly did not, notwithstanding some of the conspiracy theories you see out there. I think that, we're continuing to provide good care, but I do think that facilities are suffering from not getting enough resources. And I talked about the federal response. The governor had announced, as you know, $30 million. And as it was announced at a press conference, it was really aimed at nursing homes. But then in implementation, it changed to all of long-term care. And I think in the first round of disbursements, which were about $11 million, a lot of facilities received grants, which was great. This second round, which just concluded, or at least the disbursements were made, very few facilities received grants. And some of those that did, with all due respect to them, were not Medicaid providers. And I'm not suggesting that they don't have some level of financial exigency that, warranted financial assistance from the state. I'm not denying that they made a case. I'm not suggesting that they don't deserve help. But, I'd sort of hope that maybe those who are caring for the state's own Medicaid clients would perhaps be towards the top of the list when it came to providing assistance. And we have no earthly clue as to what the criteria is for dispersing these grants. We had asked the prior head of Gopher for an explanation. He's no longer there. We never got an explanation. We're asking the current head of Gopher for an explanation. We hope to have him be able to address our board within the next couple of weeks and try to get a sense of the basis for dispersing these funds, because I can tell you that there are nursing homes that have had outbreaks that were not able to get any funds in the second round. And it's just unacceptable. I mean, they were demonstrating losses. And my personal theory is that the state, and well, I don't think it's a theory, I think it's been stated, that the state is hoarding CARES Act funds, flex funds, in the hope that Congress will allow it to use those funds to backfill the state budget. I think that's a high risk game because it's assuming that Congress will do anything. Under the terms of the CARES Act, as you understand, you can't supplant. You have to have a maintenance of effort. And I have said for some time from the very beginning that I suspected that New Hampshire might be the only state in the union that actually returns federal money to the federal government because it will not spend it by year end. And if it isn't spent by year end, it reverts. So that's my concern, is that money that could otherwise go to long-term care facilities is presently being hoarded.
Thank you, Mr. Williamson. Further questions from the committee?
Could I ask one more that hopefully just gets a one-sentence answer, because I know we have time pressures. As we look into the issue of mental health issues for the residents and to some extent the staff, but mostly the residents of our nursing home and long-term care facilities, can you recommend any other states that you say we should look at specifically because they're doing just a great job?
I'm sorry, one sentence, oh boy. I talk with all the other state executives on a weekly basis, and I really can't point to a state that is doing a better job on this. I think it's the conundrum that we all face right now, Representative.
Thank you.
Thank you very much, Mr. Williams. In the interest of time, Senator Ward, you don't have a question, right? No. Okay. In the interest of time, I'm just going to ask you if you'd be willing to answer any questions that do come up from the committee following this meeting. Your information is obviously very helpful, and your experience just shared an incredible amount of insight with us. So I'm very grateful for that, and we're going to be pushing out a report very soon. We've got about a month to get one out. So thank you so much for joining us, and I look forward to speaking with you again in the near future.
Thank you very much, Senator. And yes, happy to accommodate any requests from the committee. And we have more data than you could ever want. So anytime you want it, just ask.
Okay, will do. Thank you so much.
Take care.
All right, Cam, do we have County Commissioner Tom Tombarello? He's already in. Excellent. Commissioner Tombarello, thank you very much for joining us. You're muted. Can you hear me okay?
Yep, can, Senator.
Perfect. Thank you so much for being willing to join us, Rockingham County Commissioner Tom Tombarello, and looking forward to hearing what you have to share with us about the experience with long-term care facility safety and wellness of employees and residents, and also the COVID pandemic. The floor is yours, sir.
Thank you, Senator. First of all, I'd like to congratulate Representative Stringham. You're going to see something that's incredible. I have my first grandchild. He's now 5 years old. Your life is going to smile a lot more than it does now. So congratulations to you.
Thank you very much.
Yeah, you're welcome. Basically, my name is Tom Tombarello. I've been a county commissioner here in Rockingham County for 8 years. And probably this is the toughest year. In March, when this all came forward to us, I actually remember the nursing home administrator saying to me, Tom, we need to lock the place down. And when I say me, I don't mean me. There's three of us. There's another commissioner, Kevin Coyle, and another commissioner, Kevin St. James. So I have two Kevins and one Tom. And, I kind of felt like we were pulling the trigger early, but I still went with them. We locked about 50 doors. You can only come in the facility by one door. And, I really got scared probably right in the end of March when he told me that we needed to buy 200 body bags and convert 2 offices to a makeshift morgue. And I can tell you, as today is September 24th, we haven't used a body bag and nobody's ever been put in the makeshift morgue. So we either got lucky or good or a little combination of both. Right now, I say as of September 24th, today, we're actually starting mandated testing. So today we plan to test with the National Guard and our staff, roughly about 500 residents and employees in the county. And we're not sure how it's going to go. We've heard a little bit of feedback that some people are not going to do it, but obviously the policy that the 3 commissioners implemented could end up to be termination, which is something that I'm hoping we're not going to do. A lot of the other counties have done it. I talked to David Ross, the administrator from Hillsborough yesterday, and asked how it went with him, and he seems to think that it's going pretty good. We implemented a program that we're actually going to pay. Right now, we're actually in an outbreak status, and an outbreak status is one healthcare worker or one resident test positive. We're in an outbreak status, so we have to test everybody in this facility, including myself. I've been tested roughly about 10 times, and a couple of them weren't bad, and then there's a couple that are really, really uncomfortable. So we're actually starting that today, and we implemented a fee that we would pay the employees to get tested. And today's actually the first day. So roughly today, we're going to have about 550 employees tested. We've been real fortunate here, and about 6 or 7 days ago, we had some tests come back, and we had some nursing staff that was tested positive. So we're really struggling with that, and I'm curious to see as of midnight tonight what the percentage is. We hope that everybody does it. I stand in line. I don't really have to get tested. It was voluntary before. And I want to show them that I'm getting tested along with them. So I'm hoping it works out pretty good. We've really been fortunate, like I said, in New Hampshire, and I want to definitely thank Senator Morgan. He reached out to me early into the pandemic. He lives in Brentwood, not too far from the nursing home here. And he reached out to me, and he got us a lot of protective equipment that we needed. Because at first, when the pandemic hit, we couldn't get a lot of the equipment that we needed. But we've been pretty fortunate, and I'm dying to see what midnight tonight brings. And hopefully we'll be, I know I've met Brendan Williams before, a great gentleman, and he talks about the hairdressing. About 2 weeks ago, I walked through the nursing home. I'm one of the commissioners that actually have residents on a name basis, and they say, "Hi, Tom," and I say hi to all of them. And I finally set up a visit with one of them, and I wanted to surprise him out in the courtyard. So we were having visits out in the courtyard, and they had to be scheduled. And I could not believe from March till September how long his hair got. And then obviously the outbreak went right back, and now obviously he was scheduled to get a haircut, but now we're not doing any admissions. There's no visitation. And I think Representative Stringham talked about loved ones, or maybe Representative Birch. When you go by the front of this, we numbered the windows out front, and as many times I come into the facility and I kind of drive by slow, and I see somebody outside with balloons and throwing kisses through a window to a loved one, and it really breaks my heart. I can go to Haverhill, Mass, and hug my mom, and these people can't touch their loved ones, can't kiss them, can't hug them. So I wonder what's going through some of their minds. But we're lucky, and again, I thank Senator Morgan for it. He's called numerous times to myself and both the nursing home administrator. So I'll answer any questions, but we're trying to keep everybody safe. I really was hesitant at first to actually do the complete shutdown, but I think by us doing it, we haven't had any tragedies here. My daughter's an LNA up in Bedford, and she tells me about, the loss of life that they're having up there in a couple of the private little nursing homes. So we're very fortunate. But I'll answer any questions. Again, I'm a county commissioner. I'm not the nursing home administrator. But if somebody asks me a question, I will get them the answer.
Thank you, Mr. Tamburello. Senator Morgan had to step away for a moment. So if
You're
any...
Kate's sister.
I am, yes.
I was going to say that. I did meet you one time. I was in the Senate Hall one time, and I did see that your sister is a real nice person.
She is. She's pretty great.
Kate's really special.
Yeah. So if Senator Morgan's back.
Thank you. Representative Stringham, it looks like you're unmuted. Did you have a question?
Yeah, can you comment at all about staffing availability and whether you've seen a change in the level of access to qualified people after the $300 was discontinued? And
Yeah. We've had some resignations, and right now, when I was first elected 8 years ago, we had one company that we would call on call for, whether it be an LNA or an RN or whatever we needed for nursing staff. 8 years later, we have 8 that we call on. So we're really behind the 8 ball on staff. We're okay right now, but we really are shorthanded at times, and that puts a strain on all the other employees, a burnout factor, which is a concern to the 3 commissioners and the nursing home administrator. Right now, we're pretty good, but I tell you that it's really been pretty stressful. And Some of them don't want to come back to work. When they did the $300 thing, it really created a problem for us that people did not want to come back. We're even having problems with people don't even want to get there. Some of them downstairs when when we're not in an outbreak, don't even want to get their temperature. We have a couple of people that think for some reason that the thermometer can do damage to their brain. I don't think that that's a medical thing that's really happening because nobody would be doing it. But it's when you get a big group of people, you're going to get some hard times. I hope that answered your question.
It's helpful, thank you.
We're about 80 nurses short. I can tell you that. I got a email yesterday from the interim director of nursing. We're about 80 nurses short, but if you go to the nursing homes across the 10 counties, I think you'll find the same thing, that the shortage is just, and we're trying everything. I mean, way back, we offered so many incentives to get these people in here, and our nursing home just became union. We have 8 unions here in Rockingham County at the facility, between maintenance and the lawyers and county attorney and so on and so on. So it's a new system right now with the union. So hopefully we can work through that part of it.
80 out of how many total?
You know, it looks to me like the paper that they gave me yesterday, we have about 300 individuals that are going to get tested. So somewhere in the nursing home part, we're in the 300 area, personnel.
A significant proportion. Thank you, Commissioner. Senator Ward?
Yes, I know there's a certain number of false positives. When you have somebody who tests positive, do you do that test again, just to double check?
Yeah, and we're actually fortunate. When I talked to the interim nursing home director yesterday, we have one of those Quintel Sophia machines, and she had said to me if there's any way we could get another one. That one's the one that really gives you the quick results on a 15-minute ratio. But we are testing. We're testing every 10 days. We're testing over here. But right now, we're in an outbreak status. We mandated the mandatory on September 21st. And CMS recommended us to do it. So we did it and we implemented it. And today's actually today's like the first day of school here, I guess, to see how it's going to go. And I plan after speaking with you folks to get right down there in line and get the test, because I saw the National Guard when I was pulling in this morning.
But if you test positive today, will you have the test repeated like tomorrow?
I apologize, Senator, I don't have that question. I can get that and get it back to Senator Morgan if you want. I just don't have that question. I don't have the answer.
Okay, I'm just curious because I think with a certain percentage of false positive, I think would be important to know what
Yeah,
the
we have
accuracy of the test.
Yeah, I can tell you that we've only had one resident test positive, and there wasn't any symptoms with it. So we're hoping it was false positive, and she's back in the regular population. I know one of the representatives talked about the financial aspect.
Right.
We're not taking any admissions, and I talked to the finance director yesterday, and we're going to have a problem with our revenue. I mean, even we did a renovation, $12 million renovation for short-term rehab, and we're not taking any admissions, and short-term rehab pretty much is a profit for the county. And right now we're not taking any. I actually have somebody that lives in my hometown. I live in Sandown, New Hampshire, whose mother broke the hip and needs to go into rehab. And I had to tell her, unfortunately, we're not taking any new admissions. So I don't like to tell a taxpayer, especially in my district or anybody, that we can't take that person. So I'm hoping that on the 28th, we're thinking that we're going to be able to open back up after we do the testing today. We're hoping by Monday that we're back on some kind of normalcy.
Okay, thank you, Mr. Tombarello.
Commissioner, I'll be very curious to hear how the testing regimen goes for you and for others. I think that would be really helpful for us to understand particularly given that the weather is changing, and we know that this is going to be a more significant element of the next couple of months to ensure the health and safety of both the residents and employees and staff. So I'd like to check in with you in the coming weeks prior to the submission of our report by November 1st.
Okay, Senator, I could probably have that for you Monday. We're planning, and I'm really, really hopeful on that we can open this facility up. We were so close, we just started to do outdoor visits. Like I said, that we were gonna start doing some haircuts, and I saw my friend there. You can't believe how quick your hair can grow from March till September, but I'm hoping, because I walk through the halls. I'm here pretty much, every day somewhat, and as a commissioner, you're always here, but it's kind of sad. And like I had said, the part going by the front, I kind of sometimes think I don't want to drive by the front when I see somebody outside with balloons that say I love you and them just throwing kisses through the window. It breaks my heart, but obviously we want to keep them safe.
Yep. And we appreciate you keeping them safe. I know it's a really difficult balance, especially given how important it is for folks to know that their loved ones are thinking about them and want to be with them. Commissioner, the other issue or the other question that I had for you, and you might not have a specific answer. I know that you've tried a lot of different things along the as you've been trying to retain and attract new nursing staff. Is there anything that we can do that you can think of at the state level to make that a little bit more feasible for you, so that we're not having constant, we're constantly scrambling to fill shifts and making sure that our taxpayers have the services that they need, so that we're not turning people away?
I think the big problem right now is just the schooling. A lot of them are doing online. Like I said, my daughter's in LNA and she's online doing the schooling. With the schools being closed and stuff, we just need to do something right now. Actually, when I tell you that we have the 8 agencies that we call, I think just the nursing industry is just so short-handed. We're actually looking into going international and actually getting nurses from other countries to come over here. Our nursing home administrator had attempted to start that, and I'm going to do a follow-up to see where we stand with it. But who would believe that we could possibly end up with like nursing from Australia or some other country to come here and work in New Hampshire because the shortage is that bad? I'm an electrician, and I can tell you that I had done a study. There's 40,000 licensed electricians. I don't mean to drift away, but just to use an example, 40,000 licensed electricians in the state of Massachusetts. And they put all of the ages into a computer and they scrambled it all, and they come out with the average age for out of 40,000 electricians in Massachusetts is 59 years old. So that's an industry that's going to be tough, because that's the average electrician is 59 in the state of Mass with a license. I think here we just don't have enough nursing. I think we just got to get these people. I have, every time I can, we try to do incentives to get them here. We go to the school when they graduate, basically try and get them right away to come sign on here. And our HR department works so hard to try and go out there and get these folks to want to come over to Rockingham, which I consider the greatest facility in the state.
Well, we're proud to have it in Brentwood, and thank you for all the work that you do for the entire county, Commissioner. We're lucky to have you.
Thank you, Senator.
Any further questions from the committee? Seeing none, Commissioner, I'm sure that we'll be asking you some additional questions as we finish up this report for during this month. So thank you so much for being with us.
Thank you, everyone. And again, Representative Stringham, you're going to have some great days ahead.
All right, committee members. Let me just, sorry, I'm trying to pull up. So committee members, I would encourage you, if you have not already reviewed the very, very early draft report, basically a summation of what we've done, some of the proposals that have been put forward, and excerpts from, significant excerpts from the testimony that we've received. Cam really, Cam, you did a phenomenal job with that so far, and I want to single you out for a moment and just applaud your efforts there, because it was really, really well done. Thank you for.
Thank you, Senator.
And so, committee members, I would just encourage you, if you haven't looked at it yet, to look at it. If you have looked at it, I'd love to hear what any thoughts that you might have on it are. Don't all talk at once.
Well, obviously, we had basically 1 hour of testimony at that point. I appreciate, starting to have items to kind of plop into whatever our final recommendations might be. I guess it's structurally helpful to have those pieces to plop in, but I'm sure there'll be dramatic changes between now and November 1st in terms of what we choose to emphasize and what recommendations we make. It obviously is a huge topic. It's monumental to try to make a big dent here in 4 weeks' time. But hopefully we'll make some solid recommendations, and maybe recommendations on what to do next term as well. So.
Just so I'd like to continue our dialogue in terms of additional folks that we would like to have join us. I've reached out to Tom Blonsky from Catholic Charities, and I've over the course of my first term had the privilege of being with him and walking through long-term care facilities that their organization has run or runs. And I've also been in touch with PHI National, which is a national organization that works to ensure quality care for older adults and people with disabilities by creating quality jobs and direct care workers. So I've been in touch with a couple of their folks to try to nail down a time for them to have a brief discussion with us to share their insights in terms of not necessarily what's happening here specifically in New Hampshire, but I've heard the question come up a couple of times now in different contexts of what are other states doing, or what are the situations in other states. And so I think that this might help us to really get better insight into more what's happening from coast to coast here in the country.
Without asking a question that may be too delicate, but what about having somebody from Health and Human Services to ask about direction of the state and how they see their direction going out of that office in terms of the issues we're looking at?
I don't think that that's too delicate at all. I think that's very pertinent. And keep in mind that there are multiple avenues that we could ask a person from HHS, because it would be really interesting to have a brief discussion about policy level discussions about long-term care facility workforce, because we know that that's a major issue. Commissioner Tom Morello has shared that with us, and I've heard it over and over again from other folks in leadership positions, that just recruiting and retaining staff is one of the biggest challenges to providing quality care to our residents in New Hampshire. And but we can also go down the path of discussion regarding COVID and how lessons learned from the last several months, and going into our transition to the colder months, how we're prepared and ready for what could be hopefully is not, but what could be increased rates of communication of COVID, unfortunately.
Yeah, one aspect, and this may affect who gets invited, is to a large extent, the state follows pretty much without deviation instructions from CDC. And then on the other end, there's a certain level, I'm not sure what it is, of discretion at individual nursing homes and long-term care facilities. And I'm wondering from the state's perspective, which is in between the nursing home and the CDC, where they see flexibility, where they see nursing homes being able to vary directives and where not, and how they see policy being implemented. So something on the policy end, I think, would be useful.
Great. Thank you for that, Representative.
No, I had suggested in the beginning that we take a look at all the LNA programs that are available and how many graduates they're having. Did we ever get that information?
I don't believe that we did yet. Cam, maybe we can put that down for a note to follow up on, because that would be very helpful. I think Senator Ward makes a very valuable point there.
Sure.
You know, and it would be interesting if we could have some conversations with maybe a couple of folks who run those types of programs to share with us what graduates of those programs look for. And the direction that I'm going with this is the affordability of housing for early graduates, particularly in the southern part of the state where I am at right now, I know is a huge challenge. My wife is in healthcare, and she's a director of operations for an urgent care facility. Well, guess what? They have major issues in terms of attracting and retaining folks as well. And so, I mean, this is not an isolated thing to just long-term care. This is a very significant issue for for the economy.
Right.
I had a leftover issue, which I just remembered now, that possibly I could have asked Mr. Williams, but occurs to me now, but not earlier. And maybe we can have somebody who can address it. If we can have staff come in at 1 o'clock in the afternoon, 9 o'clock in the morning, whenever their shift begins, and they get tested and then go in and do their job. Why not activities people? You know, the people who run the bingo games, the people who play the music, the people who do dance therapy. Why can't they be coming in to our facilities on the same basis, assuming they're willing, that staff come in? Are there any impediments to that? Because if we're talking about trying to reduce the disruption in the lives of, especially with people with dementia, then as much normalcy and as much activity and as much decrease of social isolation as that is possible, we should be trying to do. So I don't have an answer to that yet, and maybe somebody can address that in the future.
Yeah, we can try to get an answer from Commissioner Tombrello or Mr. Williams. Great. Anything further from the committee? All right, seeing none, can we open it up to for public comment? Alan, there you are. Can we open it up for public comment? You're muted, Alan.
Hold on 1 second. All right, if there is anybody that would like to speak, if you guys could use the chat function, because for some reason I can't allow it right now to raise your hand. Anybody?
All right. Well, seeing none. Seeing none, we will we'll adjourn for now and look forward to seeing you all in a week. I think we're making some great progress given our extremely short time frame and the significance of the issues. So, you know, I'm pleased with how we're going. If you need anything or have any ideas that strike you in the next few days, please, you know how to find me.
Sorry, I just got the ability to raise their hand. So
Okay.
one more time, if anybody has anything that they'd like to put forward to the committee, please raise your hand using the more button there.
Mm,
All right, we have Nancy West.
Chair calls Nancy West.
Yes, good morning. I had a couple of questions that I was hoping might come up today, but didn't. And they're questions that I've been trying to get answered by the state and have been unable to do that. So should I put them in writing to you, or would you like to hear them now? I'm a reporter with indepthnh.org.
Ms. West, you are welcome to submit your questions to, how do we do this, guys? Cameron, is that the best?
I think probably the best route would be if Ms. West has questions that she's submitting to the full committee, that she submit them in writing to Cameron and he can submit them to the members of the committee.
And Ms. West, my understanding of your question was you were trying to get certain things answered by, you said the state. Are you referring to the administration or by this committee specifically?
Oh, no, not by this committee, by the Joint Information Office that has been set up by Governor Sununu, by DHHS, and by the governor's office. I went through my list of unanswered questions and I have probably at least 3 dozen that have either been ignored or not fully answered. And some are fairly basic, you know.
Ms. West, I think it sounds to me, while this committee would be more than happy to receive your questions and review them and provide any insight that we can, given that we are all in the legislative branch and all of your questions have been directed to the executive branch, I think that I would, in an effort to get you the specific answers that you're looking for, I would have to refer you specifically to the executive branch. And, you know, but again, please, you know, our door is open.
Ms. West, if you want to submit your questions to me, I'd be more than happy to try and facilitate you getting those questions submitted to the appropriate members. But like Senator Morgan stated, this is a legislative committee. We can't only facilitate passing along the questions and
Well, no, these are questions that I would like the committee to answer as well. I can't get them answered through the state. I bet you can. And they're not really complicated questions. Some are, one of the questions, for instance, would be how many patients were in nursing homes at the very beginning of the pandemic? Not how many
So
beds.
Ms. West, like I said, why don't you submit them to me and to Cameron, and we'll do our very best to facilitate, you know, seeing what questions the committee could answer, and then facilitate putting you in touch with the people that would be able to answer the questions most appropriately.
And I also think they're questions that your committee would want to know the answers to. So I'll be happy to submit them.
Great. Well, thank you so much, Ms. West. I appreciate that. Further questions from the public? All right, seeing none, thank you everyone for your time and attention this morning. Really appreciate it, and we'll see you in a week. Oh wait, do we have to adjourn? Yeah, sorry. Take a motion to adjourn.
So move, seconded, whatever.
Senator Ward.
I'll take the other one.
Senator Ward.
Yes.
Representative Stringham,
Yes.
Representative Birch,
Yes,
Senator Morgan's a yes. Thank you all very much.
Thank you.
Thank you.
good meeting.